Prodovite. Nutrition that gets in.
Haidee, are you with us?
Yeah, I'm here.
Haidee, and Heidee's had some unbelievable stories about Aaron and Jesse, her sons. But you said something tonight on the pre-call which had to do with just general sleeping. You want to repeat that for us?
Sure. I went to a sleep study, and I was diagnosed with sleep apnea. And it wasn't, my body just, when I was dreaming, I would stop breathing. So it was some kind of a neurological thing that was happening. And my oxygen would go down. They measured the oxygen. It would go down to below 72% in my body. So that was significantly low. And no wonder I'd be waking up totally tired and headaches, always headaches. And I was doing so many nutritional things, and I couldn't figure out why I was still constantly so fatigued. And a lot of things came up after that I found out why, but this was a big thing. And I had been taking some sleeping pills because I had so much pain from other things in my body and some injuries and stuff. So I'm thinking a lot of it had to do with my sleeping pills as well. Just a low dose, but regardless, I was taking that. And so after taking the Prodovite, and I had to have a CPAP unit, one of those things that help you breathe at night. And I didn't know that it was helping that much. I had just started doing that a few months ago, but snoring and all of that. And it was about 2 weeks after taking the Prodovite that I noticed that the CPAP wasn't really doing anything for me. And so I thought, well, I'll just try not to use it and see what happens. And I was waking up more refreshed, and I don't snore. My husband says I don't snore anymore. And I'd like, when I went back to the sleep study the second time, because they always do a follow-up, they can't believe that my oxygen stayed the same and everything else, and they thought it was from the CPAP unit, and I said, well, I haven't been using it. So they weren't very impressed with that at all, but I told them why, because this Prodovite helps to oxygenate the blood and all of that, and so they're just, what? And so I told the doctor about that, and he was just fascinated. So he's looking into that, but he didn't think that was at all why it was happening. But absolutely no more. I don't wake up with any more headaches. I sleep better than I've slept in years, like absolutely better. And no sleeping pills at all, like none. So I'm pretty much off all medications, including pain. Now, I still take some painkillers once in a while on a really bad day, but that's mostly if I didn't take enough Prodovite or whatever, and that is huge for me, absolutely huge. So, and my son, Aaron, who also has a propensity to snore, and he was waking up tired, I didn't notice until just actually a couple of weeks ago that I thought, he's not snoring anymore. I mean, it was always the sign that he fell asleep is when he would start to snore. And I mean, he was the loudest of all. So he and always waking up with dry mouth and nosebleeds and all of that. And he's just no more snoring whatsoever. And so I was saying to Bill, I don't understand why, how the Prodovite helps with that, or even the brain reward, but it's doing something. So I understand about the sleep, but why it helped the sleep apnea, I'm not, I don't know how, but it really, really, really helped with that. So I'm just absolutely over the moon because I'm not waking up tired. That was my biggest thing, is always the fatigue, total fatigue. And I was one of those people that didn't get the phenomenal results right away that a lot of people got. And I was a bit discouraged in a sense because I was really hoping to feel something. And it took a while. Like, it took about 2 weeks before my sleeping was really better. And then a little bit longer after that before I really felt like I was turning the corner. But it's been years and years and years of total fatigue and stress on my adrenals that had to be rebuilt. And so the fact that I'm actually sleeping better now in such a short amount of time, this is now 6 weeks that I've been on the product, compared to all my life, right? So that's just huge.
Wow. Thank you, Haidee. Bill and Steve, here we are talking about taking average and going above average. How many people out there are not sleeping well? How many people are tired when they're at work? They wake up tired. They never really feel refreshed. I mean, it is a major, major issue that most people have, but they don't think it's a major issue in regards to health. Now's our chance to let them be aware.
Yeah, absolutely. The sleep issue, and we've had a lot of people who have commented from one level to another that their sleep has improved, and I think it's important to remember that sleep tends to get worse as you get older. A lot of people as they age, they don't sleep as well, and that's when aging occurs. And deep sleep is when your body heals itself. It's when the body goes in and starts to rejuvenate and repair things. If you're in a good sleep, that's when the system works. So not only do you get the benefit of the sleep, hopefully, but then since the nutrients are present in the system, whatever the body is supposed to be doing, the nutrients are there to help it achieve whatever goal it's trying to achieve. So it's kind of a 1-2 punch in that aspect.
Wow, it's just that even getting above average is amazing.
Well,
and very much.
Yeah, just one other point too. I just want to say that because Haidee mentioned, I don't know how it helped the sleep apnea, but it did, and we don't either, and we don't necessarily even have to know, because that's not what it was meant to do necessarily. We didn't put a product together to help sleep apnea, but the fact that it did means that the body's own intelligence, like we always say, is taking the nutrients and helping to correct whatever imbalances are there, and the results are what she sees. So I thought that was a great example of how it's working.
Yeah, and the other thing about the doctors is that, the cavalier perception that the doctor has about, it can't be that because he's never seen that before. I mean, when you're delivering nutrients to the cells the way that Prodovite does, again, as we've said so many times, this is just incredibly good nutrition that gets in at the same time so it can support the symphony of metabolism. And doctors have not seen anything like this, ever. So don't be surprised if your doctor has a cavalier or a nonchalant attitude about it, because he's never seen anything like it. So just enjoy it.
Bill, I have to jump in here and say, if we realize how many doctors really trained on nutrition and trained on it a lot at medical school, it doesn't happen. So they come out of medical school not prepared for what wonderful nutrition can do, and hence when you come in and tell them, they're a little skeptical. Then maybe it's our job to train them.
Yeah, and they've never, in school, they never thought that anything like this could ever happen. Keep in mind that even drugs that are prescribed are based on the averages. They do studies and look at how the average effects are. They don't even know what normal is anymore. It's just based on averages. And when it comes to nutrition, when you look at, for example, a study that was done recently with a multivitamin for seniors that was found to actually promote, liver problems. But the industry, the media came out and took a broad sweeping stroke and said all multivitamins are not good and could cause liver problems, is just absolutely ridiculous. They have never seen anything like this. They were never taught to even think it was possible to see anything like this. It gets in. But what it does once it's in the body is, as Steve just mentioned, is entirely dependent on the body, on your lifestyle, your genetics, level of your health, your needs. It just, uses the body's pre-programmed. to use all these nutrients in the best way that it can. And we don't know what that's going to be. So just give the body the incredibly great super nutrition that comes with Prodovite. And as Paul says, make the average feel way above average.
Yeah, well, my only other point, I thought that was really good. I liked you said the symphony of metabolism. I like that line a lot because that's what it is if it's working right. And as far as the doctors are concerned, my hope is that there's enough doctors who, we don't want to do their job at all. We just want to work with them and help as much as possible. And I think in this case, a lot of the doctors who are forward-thinking and really have their patient's best interest are the ones that say, well, I'm not sure how it's working, but if it is, by all means, stay with it, and we'll continue to work on other levels of your health. And they promote that because they know they don't know that much about nutrition, and they're willing to keep an open mind.
Yep. We have some great doctors already getting involved with Victory and our products, both for the Prodovite and the Brain Award, and in a few cases a combination of both, with extraordinary results under a doctor's supervision. It's incredible to have that kind of validation, and we're continuing above and beyond our clinical research. We continue to get that in a medically supervised environment.
Definitely.
Fabulous.